entertainment. Stay tuned to Society for Radio Democracy 98.1. Simply the best.
Radio Democracy 98.1 FM. It's exactly 12 noon from which to the time and on a time for we news brief and we current affair program media show. Continue for stay tuned and check it out.
The true voice of the people. Radio Democracy, the true voice of the people.
This is a news brief where they come to you from the Society for Radio Democracy 98.1 FM with me, Sonia Bell. The defense spokesperson, Air Commodore Hassan Siekomba, don't confirm say Guinea soldier them don't hold some Salon soldier and policeman them na the Guinea Salon border na Falaba district inside one border Chambot. Magistrate Brahima Jah na Pademba Road Court number 1 don't send Zainab Sharif go on remand. Na the Female Correctional Center on enforced appearance for answer to 2 counts charge of threatening language and other one. Some people are free-tongue is concerned, but the personal killing wey don dey happen in different parts of the country. Then people are raise this concern with Radio Democracy, where then they talk about the personal way how people they kill and comping them in different parts of the country. Outside and say governments forget rank to law and policy them, we will tap people for kill and comping them, we don't pass mark. The Chief of Defense Staff, Lieutenant General Amara Aidara Bangura say not to sell them, they sell Juba barracks, but say na trade they trade them off for raise couple for take care of soldier they need. Inside a talk, the Chief Minister Dr. David Senge say the worker where he go do na the Juba barracks na for know the status of the barracks. With this decision, now one way is say government be grieved, and this is saying a part of government support for CISE soldier them gets better condition of service inside for tab. The principal na the Malekure Secondary School na Makama Chiefdom, Putroko District, Amara Amsin Bangura say na only 12 out of the 24 teacher them where they teach na this school gets been called. And the German ambassador to Salon, Pascal Richard, don't call on Salon governments for tap for use them flag on ship them na the Black Mediterranean Sea and Atlantic Ocean. As he alleged say, Russia they use them shipyard for transport smuggle in them where they Hamburg world peace. That's a news brief we come to you from the Society for Radio Democracy 98.1 FM with Sonia Bell.
And welcome to the program Media Show where it comes to you from the Society for Radio Democracy 98.1 FM. And we so on the internet on www.radiodemocracy.sl. Me na Karifa to content where they bring this edition of Media Show come to you. Like all time inside this program, we get plenty news, information and entertainment. So stay with me for the next 1 hour. You can be part of the program by way of sending comments or text message to the number 077981981 or if you go on Radio Democracy Facebook page. The program now Media Show it comes to you live from the Society for Radio Democracy 98.1 FM. Well, inside the program with me today, I get Mohamed Usman Kamara, in the Executive Director na the Sierra Leone Association of Persons with Albinism. Also, I can talk about the challenge where they face and self what need for be done. More with that, I want to welcome my studio guests. Good afternoon and welcome to the program.
Good afternoon and good afternoon to the people out there.
Okay, continue for the with me now the program. Inside the program now we look at the first issue. The head of Choitram Memorial Hospital, Dr. Goidnat George don't say the plastic and hand surgery with the hospital together with some doctors them na Germany do for over 200 people and a part of them support to the well body sector na Salon. In talk this to Radio Democracy when we talk about the free surgery program where the Choitram Memorial Hospital they provide for less privileged people na Salon. In talk more to reporter Chegno Jalo inside this interview.
So the press conference was to make you people aware and everybody know that we are providing free service to the people who need the surgeries here regarding the plastic surgery and the hand surgery and congenital anomalies if anything are there. So these people have come from Germany. They come every year. Since last 3 years, 4 years they have been coming in. And they had been doing cleft lip, hand surgeries, burn contracture cases, and all types of plastic surgery and hand surgery cases.
For the last 3 years, they have been providing this free surgery.
4 years.
4 years to Sierra Leoneans.
Yes.
What's your impression so far with regards to the impact of this?
I think it has improved the quality of life of the people who have been operated on. Okay, they have become self-sufficient and can do the things which they could not do earlier.
Okay.
Yeah.
So how do Choitram select people who are supposed to benefit from these free surgeries?
No, it is free for all. Everybody can come into this. We do advertisements. We put it in the social media. We announce everywhere. And the registrations, people automatically they come and register for the screening. And our doctors will screen them and then park them for the surgeries.
What provoked this particular program in the first place 4 years ago? How did you arrive at this decision to start doing free surgery for people with such conditions?
You see, His Excellency Dr. Bimba Bayo, who is the ambassador to Germany from Sierra Leone, he is the one who initiated this whole activity. Okay, he has been instrumental in bringing not only these people, he had been in touch with Germany for a long, long time. So he brought pediatric surgeons also from Germany. He has brought these plastic surgeons also from there. So he had been looking at ways and means how he can help the people of our country.
Okay, with regards to the surgery that has been done for this particular year, how many people were able to benefit?
Till now, about 200 people have been benefited.
In total?
In total,
since
in 4
the last
years.
4 years?
In the 4 years.
For this particular one, how many people?
44 people have been operated this year.
Okay. What's the age bracket?
Age bracket depends from the congenital, young babies are also there, and it is up to 60-65 years.
Are patients also entitled to further drugs after the surgery, or you only provide the surgery?
No, we are giving them surgery, the treatment and everything what is required, and at the time of discharge, they are being given discharge medication also free of cost.
Are there any complications since you started doing this?
No, not exactly, but sometimes the people will come back for follow-up, dressing and all these things. That is also free. No, but the local doctors, Dr. Wongo is involved in this.
Okay.
Our doctors are involved in this. So they will do the follow-up.
Okay.
My message to Sri Lankan people is, you see, whenever we announce certain camps like this, people should come and register for that so that they can benefit from it.
Okay. Are there any other upcoming programs for less privileged people?
We are having a colon cancer screening camp on 12th and 13th of March. And from 21st of March, we are going to have a second cycle of free cataract surgery camp.
What's the target for that?
The colon cancer is UK doctors are coming from United Kingdom, and they'll be doing it. And the target is only about 15, because the main issue is not doing the cases. It is more of empowering the local people who are doing colonoscopy and endoscopy to train them and improve their capacity. That was mainly it is a training aspect along with the screening of a few people. And in the cataract camp also it is the same idea. Even last year also we trained about 8 ophthalmologists from this country, and about 12 nurses have been trained in the cataract surgery. The Ministry of Health, they deputed them here and they were trained here. Even this year also we have requested the ministry to depute doctors and nurses during that camp, and it will improve the capacity of the people.
Well, that's now the head of Choitra Memorial Hospital, Dr. Goyednath George. We talked that interview today with Chegno Jalo and say the plastic enhanced surgery with the hospital together with some doctors in Germany do for over 200 people them na part of the support to the wet body sector na salon. The program may show they continue, and as I've been introduced my studio guest earlier, when I'm Mohamed Usman Kamara, the executive director na the Sierra Leone Association of Persons with Albinism. As today in the also for talk about the challenge where they get and self what need for be done. So Mr. Kamara, let's start for talk about the Sierra Leone Association of Persons with Albinism.
Well, the Sierra Leone Association of Persons with Albinism na an organization where they seek for the welfare of people with albinism. We salon people can call Jews, and we see the rights of people with albinism then be met, and people they violate the rights of people with albinism, and we included in the day-to-day things that would happen to any other human being. How we for make people with albinism feel see them also a human being and then belong in society without fear of discrimination, prejudice, and any other thing we go make them feel less of a human. The organization don't be founded from 2015 till date, and we don't do things them for build the community. So waiting at the priority more, yes, we the fight for the rights and other thing, but also want for build a stronger community. We go talk for people with albinism in the foreseeable future, because we did think for the born people with albinism. Say we die and other people then come. So we want for build, set the blueprints where other people then will come and follow for CC people and not violate rights in all aspects of life.
So what are some of the things way una don't do form since 2015 we una form this association?
Okay, so when we form now, we are for where we start really 2015. We see the need for bring we self together as young people with albinism, where we feel say we be on the serve or we not be the get waiting we forget up till now, but I think it better now. But then the main priority, the main goal now for let people know say we self there and we voice them important in society. So that was the goal, and we start for do that one day. Together we company them, they reach out to people, them they ask if they get possible with albinism now. So they fight for build our community. So after that we start for being get people that will be help with small sunscreen, because all waiting albinism surround a genetic condition. We now the lack of melanin, and because you lack that melanin, your skin the damage, and all the surrounding, all waiting albinism surround na health issue. We underlying condition of health, and because of we lack certain things we forget or not get, and it cause we skin them for damage, and we low vision come inside. So because of that lack, we don't get this color we get, make even with physical appearance at times can warrant tear, mockery, and discrimination amongst other people, and we melanated. So we begin give people in sunscreen, begin advocates for healthcare rights now. In a school, at least they're able for know say we get low vision and other things, them how them for able for accommodate in their school, and they for let we able for learn book, because book learning they help somebody not to just academia go to school and all, but also for educate people, and we turn our defense to the find them very challenging for people with albinism within the community. So from that side, they say 2022 we now able to get the first official project on a 2-year one. We that funded program now. By that way, the way we do we will forget people with albinism, they're also employed within the first project. Because employment for people with albinism is very, very risky. Even within the disability community, forget job. People they watch and discriminate you. So now the thing they do now, it's kind of explain you. But I don't know if you are continue or you ask me.
Go ahead.
Okay, so when we get the project, then you employ people. So the thing they do that, we don't create that organization. They don't get people. They don't get funding, and they will get employment. Then we will forget sunscreen the way they come. We will forget lens system.
Organization where una set up for una self.
Yes, the Sierra Leone Association of Persons with Albinism now, because we don't get funding from a international partner. We will help with funding. We will for begin do them programming. And now we get community meetings that they hold. We get gender specific meetings where they hold in Freetown, and the other community meeting are within Bo, McKinney, Kabbalah, and Freetown. Kenem are also included. So for now, we didn't have 5 sites, including Freetown, and we get members then at the inside and they not to just the inside and they, but all over the country we don't they give sunscreen them for free. We they get and no don't give some people and we don't able to forget some lenses where they use now at school, and we don't create partnership with people away. Also they give some glasses then now for free, and they put sun cream and other things, them hats, thing the way they protect people them, skin them, not forget damage. We don't do surgery for people them. We also now people that we don't get skin cancer, where they lead to early death, we don't get delicious and they remove people that they live healthy now. We the advocates now, schools them, talk to teachers them, they're able to understand on how for accommodate we, and also we don't engage with all are doing hospital, don't train people, nurses, then they for let them understand how for welcome difference, because from the way they see possible with albinism, go to hospital with belly, then go get comments what they make, and when them born picky with albinism, because you feel say if you church that picking day, you go born picky with albinism. So nurses then safe no one for church people with albinism not inside and so we don't do all in training and day. And we don't do so much more. And now we also they try for do social things. How forget social inclusion, because societal exclusion don't cause challenge them where people are not able to cope with. People they don't self-isolate. Okay. People then don't self-hate. So now we the fight for see how we're able for get people a mindset checked, and the people are at least able to forget that self-love for themselves, because mental health is a big issue for any form of disability. So it's very, very challenging, and then now the fight for push we make. We also the fight for going to modeling with other people and also one for do this pageantry. Also we get for also build people in confidence and enhance self-love.
Okay. So you mentioned earlier, so una don't they try get build a community where una as people with albinism go able for work together and able for empower una and make change na the community. So let's look at what are the operational barrier way una the face for reach people with albinism na the different parts in the country.
Well, first you go say finance. It takes money for able for reach out. Now they hard to reach areas them. That is very, very challenging for we. But for now we get staffed in then 5 sides and the Bo, McKinney, Kenema and Kabbalah plus Freetown. Yeah, but even in Freetown, not to every side we're able for reach. Yes, we're gonna radio them another host severally. We don't talk about what we they do and what they offer when are for free. Registration are free, nobody need pay for them. But it's challenging too. For let you get people with albinism for come out and come. Okay. So Sunday you get for go meet them. Sunday you reach out to them in the street. You call person. And they work fast. Because of waiting. Society. When people then see people, 2 people with albinism team and go say, David man, they one cancel, we understand. Wait to part. You understand? So then provocation then some people are not able for withstand then kind, mind then kind mental issues then mental health issues then because of how society they exclude winner society, the provocation on too much. Some people are not able for take them. Okay. So some people are able to take time for let able for warm up to the organization. So then in one, the transportation and other things then for each certain people. And the other thing the our society do exclude we so much that provocation don't make people and no one for come together as one, because they know one the steer and the provocation will go happen. The other thing that we really need for get stakeholders them also for for be empathize or get empathy for not so for sorry for we, but just feel say no more if now you did do so, how you go feel, or if you get picking with albinism they provoke and they mock you, and they think the way for benefits not able for get them as person with disability in general, we not get them how you go feel. So people then for come on board for also give voice, because we get ministries them and people that we also now the responsibility for make sure say the life of people with albinism they live healthy life, safe life, because when you say safe life, they're not for free for mockery. I know for the personal skit are the free say they go provoke me, so I not go come on I do. I know for the personal, you understand. So all them and we need people and for come and voice come. Say people people stakeholders like the Ministry of Social Welfare, NCPD, the government, communication ministry, they're not for the left hand just because not directly, not to the ministry, they're not for the left hand saying a social welfare issue. Disability issue a cut across all ministries and departments because we are human beings. Any way they do for other person, they for do and for the people. And so you need for communicator, tell people and say, this is not human being like any other person, and then get rights them we need for be protected. We are not for violate their rights. Because go pass now see they provoke other people the way person go talk. So we need everybody on board. We not just need just we as person there with albinism, even the fourth estate, self need for they talk about things. I'm not saying I make una call way also today also, but
so look at the gap where una they get in terms of capacity building, like staffing, training, infrastructure, where they limit una effectiveness in our society.
So I think the main thing you talk about education, and education don't mean say just for go school. You mean adult education now, you mean vocational trainings and other things them, because we get within the albinism community you get lots of people and we don't be dropouts them because of vocational school, they stop for going to school because of in low vision the teacher don't understand and say they see fine, so you never for put on front, so that they can just discourage the person while for they can suffer and you pay transport. They provoke you, then bully you, then go slap you, then go knock you, then go put on before you face, ask you number this, they put the one finger down, all lensing and they're very humiliating. So people don't they see that they undergo, some people don't decide not for go school again. Then some people are within the village and other side of them come out and say, but this don't not waste money param because not a better person. We get picking the way better, we get this kind of condition. You allow we send them to school. This not going for land book. So all lensing and they then gap then they within the education ministry they do for say then get an equitable education for everybody. Waiting them for put in place. Yeah, if you know Sabi, then call on the organization. We get people with live experience, we understand the condition and understand the challenges they don't face. Follow them picking and come again and begin suffer so still. We do we best for going to schools them and tell teacher and talk to people in our assembly, school level picking they go. But not enough. If authoritative voice they not come, we go talk, we go make people listen. Like put we within where they buy book, say people with albinism now. This amount of people in our school. If they procure textbook, they say we get 5 people over the class, 5. So if they procure book, they let them put broad font size prints in book. Then they easy. Just tell the boss, say this 5 book where you put, let the font size them big. It's simple. You procure already. So just make small adjustments. They will make at least it fits that person. We exam did me they read like other person because I know they see I'm fine. I get for boot too. So waiting you go do for let you talk to the exams department for say una need for understand this. With that person I get extra time. You understand? Examination paper, let the paper then difference at least. So that person go able for they're at the same level of like the other one where they need it. So the gaps are too much and people they need for come on board for see how we go able for handle them together, not to just we. Because now they affect our family members and no everybody gets for get involved. In
name now Mohamed Usman Kamara in the executive director of the Sierra Leone Association of Persons with Albinism. As today they also for talk about the challenge where they face with albinism and waiting need for be done. The program now made a show they come to live from the Society for Radio Democracy 98.1 FM. Yourself can be part of the program by way of sending comments or text message to the number 077981981 or self you go to Radio Democracy Facebook page and join the conversation. As today we talk about the challenges there where people with albinism they face and waiting need for be done. So you don't mention some of the things and way the challenges the way the face as person with albinism. Now look at we get any effective or national laws and policies where they protect persons with albinism. How effective their laws then they be?
Specific laws, to say specific laws they really protect people with albinism their rights. No, we don't get that law in a salon. And we self-defeat for see how we go for push forth for that than they happen. But we get laws them where they talk about people with disability in general. generally people with albinism, we fall under that category. But when you get specific law, because we all persons there with disability, I know, we all get specific needs them. And people with albinism, you go to see like not the complication, and the people that can feel say we just normal, not just the color normal. And also the color and difference come with different challenges then.
Okay.
Where if you expose yourself to the sun, you go get dark spots there, you go get blisters, and we go lead to skin cancer. We go make you die early. Because don't get people with albinism who don't die of skin cancer. Na Salona, we know, we been good in our hospital, say then die. Then you get low vision, where also they affect you not blind, but they see fine. And because people are not able to understand that one, then understand how to treat, because the sight, that lens not they solve, like say the correct sight, like other person way, because now by age or something happy we make you sight, then go give you lens, we go correct. No, we born with the short-sightedness because we lack melanin. So because of that one, even when you wear lens, you will still see person. If you wear lens, they come closer for you. That means they know the correct sight. But people they don't understand, and the people that can just talk to school there or other side and say, why you not get lens? Why you not they use lens? They don't know say the lens are not able to help you that much at all. Okay. So honestly, it's really complicated, and we need specific laws for protect people with albinism.
So how the association only work with the law enforcement or the justice sector in terms of then challenges the new way on the face as persons with albinism in a salon?
Well, a very, very serious and very, very complex, because for get laws for enact laws in a salon, and it gets so many challenges. They still work on now and day. We also don't try to form this the National Task Force on Albinism, where we invite ministries and legal aid board for be part of and all. But now this we talk, people are interested in albinism issues very, very weak, and just imagine we get people who don't invite for the ministries and department and like the social welfare, the NCPD, Ministry of Health. No, they call but few, but they will call them for let them be part of the National Albinism Task Force. But they need to turn up our meetings. You will call for meetings and then begin to say, we get other engagements, you understand, but you're in the ministry to work. So if they don't assign you, say this task force now for represents the ministry, or perhaps don't write letter, then the ministry gets the responsibility for send somebody for represent. So now that's where they seek. Then we'll get people involved. Then we'll be able for now this we want for do. I don't go able for help we. Because within the ministry, then gets networks, they know waiting for do. So then able for guide we follow able for do, give people with albinism the rights so they deserve. But we know they get down there right now. So now the challenge down there will the face. How forget people are interested in see people with albinism, they live safe, healthy, and with dignity and respect in our society.
Okay, continue for the with me at the program. And name now Mohamed Usman Kamara, in the executive director and the Sierra Leone Association of Persons with Albinism. As today, they also for talk about the challenge where then the face and self-waiting need for be done. The program now they show they come to live from the Society for Radio Democracy 98.1 FM. Yourself can be part of the program by way you can send a comment or text message to the number 077921981, or if you go on our Democracy Facebook page. Well, inside the program now, not time for make we take music break.
Yeah. Love amongst your brethren, the greatest thing on earth, like heaven on earth. Rastafari give birth. Listen.
She said, oh yeah. Jealous, she said, that's right. Disrespect, she said, oh yeah. Let we help, we said, oh yeah. No condition of permanent, that's right. Everybody be one in my parliament. togetherness.
Oh yeah,
They bring progress.
that's right.
Let we get we country interest. And interest when we said we all go walk up on success. Now, people, do you make we come together forever? The country just go, they go stronger. Selfish that matter, ten Congos are not proper. Because we drink and boku off a flava out. Look how we country turn back. We get this, we get that, but still they suffer. People, do you make we come together forever? The country just go, they go stronger. Selfish that matter, ten Congos are not proper. Because we drink and boku off a flava out. Look how we country turn back. We get this, we get that, but still they suffer. Let we left sectionalism.
Oh yeah,
Favoritism,
that's right.
easy man schism,
Oh yeah,
corruption,
oh yeah,
suppression,
that's right.
oppression. We want unity,
Oh yeah,
justice with purity
that's right.
in our society. Well, like we said, and try for duty for ourselves. So we know we sit down, we see salon de for dumb. Don't try for pull your group and on the left, you only down. That's for done, and this is precious gone. So let we get on the run, so that we done on the gone, yeah. Check it out, man.
Well, I hope so I don't enjoy that song then at the program. The program now made a show they come to you live from the Society for Radio Democracy 98.1 FM. And where they bring you now this edition of the program, made a show me name na Karifa to Conte. Inside the program we look at another issue. The International Liaison Officer for Junior Doctors Association Salon, Dr. Abubakar Jallo say, doctor then get challenge them like condition of service and salary. Dr. Abubakar Jallo talk this is our interview with Radio Democracy. When we talk about some kind of challenge where they don't get, he explained more to reporter Sonia Bell inside this interview.
So the Junior Doctors Association na a national umbrella body where they encompass all doctor them we done their studies and they don't start for practice medicine and they don't get license from the Sierra Leone Medical and Dental Council na Salon from the time where they begin till 15 years. So all them group of doctor then they part of the Junior Doctors Association.
Okay, so we sense the soon insurance concerns. So what are some of them concern they are we una get as junior doctors?
So we concern them not to big problems they would see them. Now things them way easy for solve if the one day where they before they actually get the intention for solve them thing then they. And the thing there, nothing where they seek the welfare of the healthcare system, not only with the junior doctor them. For example, the welfare they will get have 4 key one them. Number one, a way doctor they don't graduate, whether they train a salon or they train other side, they not for sit on a house for more than 1 year. Government not take them for make them begin work. We be say the hospital they not get enough staff. So we they say from the Junior Doctors Association, then doctor then way they don't graduate, when I pull them a house, when make them kind of hospital for increase the staff, become a well trained and qualified doctor then. As we speak now, we get 79 doctor then we just graduate from commerce, then they na us. Number 2, as doctor then done their house job. Some of them they sit exam, the primary exam for make them start their specialty. Some of them as they done their house job, then for upgrade them to medical officer. That process we supposed for they take 1 month or less. You they done your house job. You begin practice as medical officer. All the work we do now as medical officer or now as a resident, but still you they receive house officer salary. That means doctor we just don't start for work salary. So we tell the government or the people that were responsible say if somebody don't due for be upgraded, then for upgrade them. And if they upgrade them, the upgradement not only for the in paper, but for also reflect your salary. Number 3, of the issues that we raise, now that most of we members them, the junior doctors, and as I tell you, that doctors they don't begin practice from 1 year to 15 years. Then why also some of them are registrars, some of them are specialists, some of them are house officers, some of them are medical officers. All these kids are also, we get a category of them we members there. So most of them for the past 6 months now, they cut their money, then salary where they supposed for they receive, where they receive before, they cut that money there. Now we don't go to a number of offices for inquire as to why they cut their money here, so we don't get no answer. And the one way for solve them problem here, so regardless of the letters the way we don't write to them, clearly indicate we don't even make list of the doctor the way affected, we don't meet them, we still not get any solution and we not get any feedback. And the fourth, now that doctors them, we grade of employment, we entitled to fuel allowance. Every 3 months, we're supposed to receive their allowance here. So, as soon as I remember, for the past years, anytime doctor them issue they come up, some of them think here they come up. When I think we entitled to, not supposed for the effect for them. But waiting they happen, 3 months they pass, 6 months they pass, we know they get to allowance. And now we salaries we they use for subsidize we movement to the hospital there and we work and we know they complain. So we don't ask say what we entitled to make we get them and we know they get any feedback. So now we challenges and this and then why also we want solution to as immediate as possible.
Okay, so how this don't they affect on our well-being as us junior doctors then? And also the work.
Exactly. This it affect not only we, it affects the patients them, it affects the families them, it affects the nation at large. So right now, we get many of our colleagues them where they're depressed. Why? Because the moment you graduate as doctor, you begin practice. The family, they become your responsibility. If you don't make up your family, now your responsibility. You yourself, now your responsibility. And you work in place, now your responsibility. Me, also at the work right now, every blessed day where I come, 2 or 3 or 4 parents must meet me say, they not get money for it today. They not get money for buy some basic amenities where they need for deal with, where they near them picking them. I they get them now and then. I they take care of my family. So if me on salary what they receive, we not even enough for me. We more than half of that salary I they use them for transportation. If they go end up for cuts now money they back. What's in for happen with the means of transport to the hospital side they work? What's in for happen with the people who are the support from the family? And what's in for happen to the people who are the compensate with when our patients in our hospital? What's in for happen with them?
Okay, so what's in una wants now for the authorities and we concern do for addressing challenge how we navigate?
So the things that we want, they're very simple and they're very straightforward and they're non-negotiable. Number one, all we colleagues them, all the doctor then where the money they don't reduce for the past 6 months. We want government to give back all that money there.
Okay.
And we feel we due for more than 6 months now. We want to make the fuel allowance be given to all the doctors them, and we need a pathway going forward. We not want for the can talk now do say we not get fuel allowance. We not want for the talk then thing there. So what do you want for the talk? We want for the can tell the public or the government say we want CT scan at this place, we want ultrasound machine at this place, we want amenities and we they help for improve the healthcare system. Government intrinsically then for the able know what in the affect with and solve and what we not can talk am. So fuel allowance we need to make the government make sure saying available and going forward if they able make them go to give fuel allowance through the salary accounts. So we no go come and begin ask for them many times we not able get them. And finally, we doctors the way don't graduate, make them no go they sit on our host, make them set a committee, make a platform. We could immediately take care of doctors the way don't graduate and immediately absorb them into the system. Then begin work, improve the number of healthcare workers, improve the efficiency, and also add to the socio-economic development of the country. And as well, we want anybody we don't do for upgrade, make them upgrade them, and the upgrade not only for be reflects per paper, it will also reflect per the person salary.
Okay, so also how the welfare issues there, so don't they affect the well-being of the country?
Well, as we all know, anytime, for example, doctor them strike, it affect not only the patients within the hospital, it affect the government, it affect the economy, it affect the morale of the healthcare system. We no one resort to them points in there. That it make we tell the one they were responsible, for make sure say they addressing issue so as soon as possible.
So if the issues they are not be addressed as soon as possible, so I will not expecting for later address them. Waiting on the next plan.
Well, as Junior Doctors Association, we are just one of the members of the executive. And we get a body, we get members them. We don't engage with membership. We don't agree on the next line of action. Waiting no more with the wait. Now for time for see whether or not these issues will be addressed as immediate as possible.
It will be a message to government and to the public.
So
what's in concern here?
Me final points to the government, to the ones who are concerned, to the public, and to me colleague doctors them. Now that this country, now we all country, we all want to make the country improve. And especially we want to make the healthcare system be stable and improve. So now we on side, we try as best as possible, because as you come today, you see me at the work from this morning at Timap and I'll sit down. And at least every doctor is sleep in our hospital twice per week, and we don't get holiday. Every day we work. We continue for do we work, but government for address then issue so immediately. Otherwise, we next line of action. Nothing we no go help go help government, no go help salon. So we no go one for reach to them points and they na it make we tell them to make them make sure say they address the issue so as soon as possible.
Well, that's not the International Liaison Officer for Junior Doctors Associations, Dr. Abubakar Jalos, be the talk na the interview with Sonia Belusa and say, doctor and they get challenging the condition of service and salary. The program made a show to continue, and I still get my studio guest with me when I'm Mohamed Usman Kamara, in the executive director na the Sierra Leone Association of Persons with Albinism. So now let's look at how accessible the persons with albinism get in terms of dermatological care and sunscreen for persons with albinism.
Well, for people with albinism in salon now, I think for the past 3 years, when it comes to sunscreen, the availability of sunscreen, slap why don't they do that work the best for at least assist government, because to be honest with you, sunscreen are like essential drug for people with albinism, and I think the WHO also now the World Health Assembly don't pass a massive law in a resolution now we they don't say sunscreen na essential drug, not drug we people don't forget. So but for let you know now when they don't pass certain resolution and for let government take and put that into action in act. But for the past since 2019, 2020 effectively, we don't give sunscreen to people with albinism all over the country for free, because we get them from we partner them with a medical assistant Sierra Leone and Ultra sunscreen where they send them for we. They send them to England and then we can get that money, then ship them come for we. We go back the get that and begin give people them for free all over the country. I think we also don't get a dermatologist when a Salomon, when a Dr. Bete, when I think that December last year now before meet with them. So we get dermatologists in a salon where they watch people with albinism in their skin. So they work with we. So 1 time per month we get skin cancer screening now we office for free. We call on all persons with albinism within a free time for camp.
So for una free medical service una get now all government hospital?
Well, not that the thing we for happen. By law, we forget free health care, quality one too, and where we go now hospital and for at least make the we early. Now so for happen, now so the Disability Act say. But waiting the happen and ground differ. We don't get surgery the way they happen. Yes, governments they try. Where do we get the service for free?
Okay.
You understand? They do the operation at the hospital. They pay. But you go work out in another hospital, you go to document under, then sign under, you go under, you go so. Some side then go put on down for say government they spend too much, this treatment here, so you get for take time, at least then go car and they go stop. You understand? Then go talk that one they say, but eventually then go sign the documents, then go treat you now. Then go do the surgery. for free. More like we cancel surgery and also admission when they don't do the surgery or before they do the surgery. Then they not free. We need pay for that one. But when you cancel, like say the drugs, the medicine and what they use on the surgery, for the surgery, the day for the surgery, and after, and they go, you get for pay for them. As an organization, yes, because we get our funds they from Seneca Trust, we they pay for that one day right now.
Okay.
We they do that one and they even for do test in a lab, they don't privatize the lab now cannot. So because they don't privatize them, today we they get some tests that what they do for free. Now some tests they when they do the, then go tell you now say this one they do an IO. This now so this the money too bulk so this now for pay for now in the happen. You understand? But now we pay for the test and they see also because if God not be don't make few organizations they put funds there, how for they able for give people in that care who not get that money as an organization for do them. Where they don't put now the Disability Act say free education for all persons with disability where we fall under that category. It really challenging for we. And I make some people with albinism no they go to hospital for treatment because if not so like skin cancer issue where they drag we as an organization more for good. The other illnesses the way can happen where somebody sick way for go to government hospital and get service for free. Now challenge.
Okay.
They go there for them service and then they get them. People they tell them say them for pay. People then go put them down and sit down for a while and not able for sit them to time. So man they go before the other one and because they know saying a person with disability or person with albinism may not get for pay, they left a less wait for us. They delay the person there. Whereby rights and say person with disability we go if we able for treat them before so if you meet two people we treat the other person, treat them one time. You understand? So but it's very, very challenging for them to get the free access to the
how
to the free
alarming
healthcare.
skin care, cancer they among with persons with albinism?
I think it's very, very deadly, and in as much as we also don't get this increased heat, where we talk about climate change.
Okay.
Climate change don't carry it immense challenge now. We don't make people and some people and the way we know when they go out, where they dinner house, all you and they send people in. Even for like a meeting, where you want call them for a meeting, they say the sun don't warm, I'm not going for calm. Hey, but don't give camp, give sunscreen, rubber, you can't. It go create excuses them. They tell you be messing at the sun because the skin don't damaging skin so much. So man don't do don't do one surgery, and if they afraid now for let something not go come on back in skin, we go cause them for let them go do other surgery param. Recently today we be get one lady when a Geneva baby we for go do surgery na cannot. They don't go do the test last Thursday. Dr. Wongo, thank you to Dr. Wongo. We're already for go do the plastic surgery. You understand? Today, we don't buy all the medicine. They don't do all tests. Just imagine, where you go now house? I don't know that they go talk to. Then say they not go do the surgery again. Then say go die there. Most of the people who don't go do surgery, they're not able for live, then die. You know, and the one they waking can then send them for surgery. Now the one they not can early, so they detect early. But for more don't get this dermatology. The dermatologist, it don't they check people that they identify early case them. Like in your case the early, you get lesions them will be don't reduce small. But because it don't reduce, it's in a con. Probably will they talk to them, don't go cancel them, don't talk to them. And we will continue for talk to them. Because we not go to that fatal point, see, we go lead to an early death. Because we don't beg past 6, 7 to 8 people in a salon from skin cancer. So it's very, very alarming. We then die bang because of the condition. So it's very, very serious, and no one let people lose their life. And government for prioritize this because climate change don't come, and they get money for climate change. What soon they do for the human beings them? Where climate change affects more, because not just the skin, the eye also. Because as much as you expose yourself to the UVA, it cause damage to the eye and the body too. So continuous exposure they make that person inside maybe they go bad more. Then the person go get lesions, go get skin cancer, we go lead to an early death. And that woman they don't begin afraid because few people they don't go cannot, don't go do surgery because the situation we don't go to bad, they're not able for like survive because it all was when we don't go to a state where you not go able for like manager again, you don't go palliative care. Now that you die.
Okay.
And that's no one and that lady don't afraid because of then result then they. So it's very, very serious. And also perhaps it go deal with that and they say it gets worse. So we need people within the donor worlds and within the international community and within the government for prioritize people with albinism when it comes to climate change impact. Not to just for talk about how for plant tree and plant that and the people and the way the thing they affect more. Where they make person afraid for common on streets. What about government for decide how for build some shady paths within the main road they pass through? Because if I go wait for, transportation, we by right to know for team up na line for go inside, where people also can frown at that one. The way is very, very discouraging. How the wait see if side they wait not to the one and they them put then thing they them put in a guide we from the sun.
Okay.
You get for build something we go guide the person from the sun. Because when the sun church will cause damage, you go see some person and get some dark spots there. Not to crow, not to not to pawpaw, not to pineapple, not to punky, not to in. Now the sun and the damage the person's skin, not to nothing.
Okay.
So how we for prioritize that? We too for do we not go able for do we no more with albinism. No.
Okay,
because
so what need for be done?
Then for prioritize we health. Where resources then come, how for preventive measures them. We get SPF clothing them. We get hats like this when our SPF hats them. We're very expensive. That lane man not go for buy them. The sunscreen and day, we get some sunscreen them. Recently we receive about 10,000 of sunscreen them. Our government for come and partner with the Ministry of Health. Then get all sign at the 16 districts and even villages they are not able to go. How we go able to come together and see we don't fit for reach out but put them. How we able to come together the sunscreen and because our government's effort to the complement to.
Okay.
Not so we rule for protect the citizens them. Governments get the right for protect we and we deserve them. Not so like we beg them. But we don't get this done. We don't say yes, we get sunscreen. How we will come for our partner, let that sunscreen they reach out to everybody in our society, not salon. Where they live with albinism or vitiligo, because we also they deal with people with vitiligo too, because they also get skin condition. We also, if they not take them, will get skin cancer because they lack melanin gradually in their skin, and so we work with people that we get vitiligo too. The one that you see some there.
The program is still listening to now. Media show they come to live from the Society for Radio Democracy 98.1 FM. So, Mr. Kamara, look at una Mr. and Mrs. Albinism way una get for all inside match.
Okay. So that one day now like intervention where the organization see them for do, we for do because we know see people and very, very then challenge with mixing, like socialize. We know say that's a problem. And somebody in the socioeconomic rights get a lot for do not to just human rights. Are you go able for fend for yourself? Are you go able for interact with other people that we no go shame or feel inferior? Waiting for do for let be able for combat that self-hate where somebody gets but himself. Because the society don't discriminate you within you household, you mama or you they talk about you bad, you neighbor they talk bad about you all the time. Go make you may feel say you less of a human. So because of that one day we come with this Mr. and Miss Albinism pageant when at the 28th of the fall we tell the mayor thank you because he's able for giving space for free. We don't get that money for going to the auditorium. So now there we go for do So we get about 10 contestants them. We for take part, but I think some then they way them body they would not fit saying but 4 they will go for take part actually.
Okay.
4 that's 4 man, 4 woman. We get for take part by this pageant and they get for build people and confidence. People are very, very timid when it comes to for let them able for showcase waiting and get people and they were interested in fashion and other things them. We get Daniela we go stand for the Africa we go winner. So because of that one day they don't give you the honors for we host the Mr. and Miss Albinism Africa we get for happen in June. But because of that, we get somebody there way for represent we in that one day.
Yeah.
So we need for do we own local competition. At least we get the 2 people that will go represent we. So we go come up victory because not to follow you host no more than can pull an iron.
Yeah.
At least we now all get role for play for let me see people able for partake by this one. We able to get the funds them for buy things them for them people and they make clear, they represent we fully. But this one they try for push for inclusion in mainstream activities them. We for able for showcase people with albinism say we're beautiful, we're unique, we not just they live with this condition in a pathetic way. We want for showcase ourselves and show the world say we are here and we represent Salon in a positive way if only we all work together for see people with albinism also achieve wetin they want for
So
achieve.
now don't put a star prize for the person we get for win the Mr. and Mrs. Albinism.
So wetin we dey look at, I make we don send proposal to different people. We dey look at on how for create, I tell you about socioeconomic business. So the star prize we dey look at for give people we it depends on the one and how they are so now. But now tricycle, you know, for each of the winners them, that are the star prize, then we get bike for the second people them. Now that we want to give them at least then go for like raise revenue. We know say every time people they give people motor car them we parent competition. You give us a motor car, you get for the fuel, you get for the rad income. All them things they get for the happy. But if you get something where they generate income, we go make that person they also able for, you know, live that life where you know go big person again, person you go dress fine, person you know go watch and that we want to build them, skills them on how for begin get income generation. Because not so all things the sunscreen get for the camel. If person get your money, they buy for himself the sunscreen. Yes, okay. It's expensive, it pass 500,000 for one tube. But if he they get money for himself, then you go able for do them. So one for like impact that knowledge in them. Say we for involving monetary generation schemes them, we go able for give them money. So now that's what they look at. So they'll reach out to many people there. They call on people for comment, see how they go for like
so it's not tickets price.
Yeah, we get different prices them we don't, so we get 250, 500 and 1,000. We know the tickets price then. So for the general public, for anybody you want for go 250,000. That's where you buy the tickets early.
Okay.
But if you buy them late, then you go na the gate, then you go pay 300,000 yuns. So you better let people and buy them early. So once we print some ticket and they recently they don't design them, sometimes we just can't left some now. 98.1
Yeah.
the people who can
Obviously, myself get for the March 28th na the
great
auditorium or na the
Great.
Freetown City Council.
yes now for support inclusion
Okay.
and say no to discrimination.
Okay, so let's look at the message within our Facebook where they come up from Mystic Nadwazak. They say, good to hear from your studio guests. Persons with albinism have been faced with serious challenges over the years, especially health challenges, which is why I appreciate all the organizations that are advocating for persons with albinism, especially the Sierra Leone Albinism Foundation. Well, that's the message we come from we Radio Democracy Facebook page where come out from Mystic Nadwazak. So what's go be message out there in terms of challenges the way una dey face and waiting governments need for be done?
Well, we need government for own them fully now that we are citizens in this country, and we get rights for exist. We get the rights, we basic human rights. You rights to life, rights to health, and other things. Then so when if skin cancer they caused by climate change and the UVA, and that one day they affect we and they cause people and for die, then the government for take responsibility for protect we. We need to let them do everything, but then for sure say they care. Now that's one for no. You for sure say you care. Government for the pull statements and talk about that one day. Say these people with albinism, they're important on society and this they affecting, and this we for do, now this we for do. Yes, we need specific laws then too. Where governments were able to do because we condition differ from other people. You go feel say like climate change not they go very soon. Not to say they pray for them, but the sun they want extra right now. Okay. You self when they live with albinism, when you come on and sun, you run for go inside. So that it, what about we not get melanin where they protect with skin from that damage where the sun rays they cause? So it's very, very serious, and we want government to take ownership of what we do. We they complement government efforts, not to we work, and government not to say una the pity we now we rights and una for protect una citizens and we are part of this country. We election get for car, we all get for vote. So una for expect we and give it the dignity where we deserve. And donor partners they una come on board and see how una go for support the Sierra Leone Association of Persons with Albinism.
Okay. Plenty thank you we joining at the program. And name na Mohamed Usman Kamara in the executive director na the Sierra Leone Association of Persons with Albinism. As today they also for talk about the challenge within the face and self waiting need for be done. And not forget March 28th, then they all the Mr. and Mrs. Albinism na the Freetown Auditorium, all na the Freetown City Council. So come and you go go that day for support the Sierra Leone Association of Persons with Albinism as in the old Mr. and Mrs. Albinism March 28th. Plenty thank you for joining at the program.
Thank you.
When I had the program made a show for today, Tuesday, 24 February 2026, we'll left you. Plenty thank you to our executive producer Michael Sambola and we producer Theodore Arena, and plenty thank you to Lucinda Williams for technical support. Fatma Tasamu will make watch you live on our Facebook page, and we'll present this edition of the program made the show come to now. My name is Karifa to Conte.